Inspire, motivate, challenge.
Thank you very much, Mr. Victor. So, I mean, that's very remarkable. I know that, I mean, it sounds easy when you said it, but I know the stakeholders that you have to interact with, both from government, private, and NGOs alike, to be able to get 20 million pneumococcal vaccines, to give access to Nigerian children at probably little to no cost. So now, since you were able to do that, knowing how difficult that was, if we were to get the COVID-19 vaccine in Nigeria tomorrow, how easy will it be to include it in the national immunization program, as you did with the pneumococcal vaccine?
Thank you, Maiwa. I think COVID vaccine is very, very relevant, and I think that's the talk of the town. And I mean, and the thinking is right that once you have a COVID vaccine, you can actually put an end to this malaise and the problem of COVID. Now, before I go into the vaccines, it is important that I explain some basic things so that we understand what may play out, in my own opinion, with the COVID vaccine. Now, if you look at, in taking a decision on a vaccine, you have to look at what you call the disease importance of which that vaccine will relate to. So let's look at the disease, the importance of COVID in itself, in terms of disease. Now, in terms of disease importance and burden, you look at mortality and you look at morbidity. Or you say you look at morbidity, that's the disease in a patient, and the mortality is, does that disease actually cause death? Why COVID is important, very important, is not really because it infects people, but it's very fatal. It causes death. Now, if you go across globe, so let's look at the world as one. You realize that if you compare sub-Saharan Africa, let's look at sub-Saharan Africa now, and you compare sub-Saharan Africa with the rest of the world like US and Europe, you realize that apart from South Africa, the deaths as a result of COVID is less than 2,000. The highest is in Kenya, 1,500, then I think Nigeria, 1,179. Or compared to USA, where you have deaths in over 200,000. Countries like Brazil, UK has over 40,000 deaths. So, and now, if you now compare the death per population, you realize that the mortality per population in most African countries is so low compared to how you have it in in the countries in Europe and the US. Now, so if you want to take a decision, concerning a vaccine, this is how it will play out. And I'll give you an illustration. You say there's an accident in a place, you pick all the victims of the accident, the casualties. When you take them to the hospital, you take some to the emergency unit, those that you know have little chance of surviving and you need to act quickly to save them. Then you take those to the general ward, those that you think, oh look, these ones are still okay, you don't need much attention. So what do? You focus first on the emergency to reduce death, because that's the ultimate goal. So take the ward as the hospital now. Where you have high incidence of mortality is the emergency unit. And where you have low incidence of mortality is the general ward. So what you need to do is to focus on the areas where you're likely going to have mortality. So in terms of vaccines priorities to the regions, it's expected, and it's good to be fair, it's expected that you will prioritize countries where the mortalities are high. Because we have to see the whole world as one globe, and we are all brothers and sisters and want to save lives. So where you get the fastest impact is where you have high mortality. That's one. So if you look at disease burden, right, it's just expected that it's just natural and it's just rational to prioritize countries where the mortalities are very, very high, right? The second thing you also have to take into consideration is this. Most of the vaccines are going to be manufactured by these countries where even the burdens are high. And obviously, charity must begin at home. You wouldn't take a vaccine outside your shores when there's a lot of critical things happening within your shores. So that's one. But having said that, I'm very glad that some trials on the COVID vaccines were conducted in Africa because I know Africa will still need the vaccine, right? And in doing that, in terms of access, there are mechanisms for actually enabling access in the developing countries, right? And this mechanism basically involve financing options, because one of the biggest challenge of actually getting a COVID vaccine, like any other vaccine, into the developing countries is the access and the price and affordability. Most often than not, you realize that these prices are actually high if you look at the purchasing power of the general populace in these developing countries. And over the years, the international world are cognizant of this, and they've set up financing schemes to actually bridge this funding gap. So you have supranational organizations like the Gavi Alliance, Global Alliance for Vaccines and Immunization. For example, Gavi Alliance, really, what they do is a public-private partnership to actually protect, to save the lives of children by making vaccines accessible to these poor developing countries. So Gavi provides the funding on behalf of those countries, right? All the countries need to do is to apply, and Gavi pays to the companies who actually manufacture the vaccines, and the vaccines get to the beneficiaries free. Yeah. So Gavi does that. You also have what you call there was, in terms of pneumococcal conjugate vaccines, there was this advanced market commitment where countries actually put resources together to ensure they could reduce the price of the pneumococcal conjugate vaccine to as low as probably $3.5, so that Gavi buys it at those $3.5 and distributes it free to the Gavi eligible countries. There are about 57 now. There were 72 when Gavi first started, I think in 2000. There are now 57 now. And there are 57 because some countries have graduated out of that belt, the window. Absolutely. And for you to qualify to be a Gavi eligible country, your GNI per capita must be either equal to $1,630 for the past 3 years. So if it's either $1,630, let's say, for example, you're doing 2020. So 2020, 2019, and 2018. If it's low, then you are Gavi eligible, because the essence is actually to give it to countries who can afford it. Once you graduate out of that window, that means you can afford to buy the vaccines, and so they save the money for countries that can afford it, right? So that's for the public sector. Even within the private sector, I must tell you that even the pharmaceutical companies also have a kind of financing mechanism, access mechanism, to ensure those vaccines also get to these developing countries through what you call the tiered pricing system. What does the tiered pricing system do? And I think GSK led that when in the launch of the cervical cancer vaccine, Cervarix. What tiered pricing means is that prices to countries should be based on their socioeconomic income level or their GNI per capita. So you can't sell vaccine $100 to UK and sell it the same $100 in Nigeria. So that's why you saw that Cervarix came in with £100 in UK, but we're still selling less than $20 in Nigeria. It was based on those tiered pricing systems. So I expect that for the COVID vaccine, these bodies will come together and bridge that gap. And if you look at the kind of awareness and the sense of commitment COVID has generated, I expect that this kind of very ingenious funding mechanism will be put into place to ensure that the people who actually need the vaccines most benefit from it.
Thank you, sir. So, basically, on everything that you said, we shouldn't expect the COVID-19 vaccine in Nigeria maybe in anytime soon.
Well, it's difficult to actually, put a time to it, right? But I see that the priorities will be based on disease burden. Now, let's scan the pipeline of COVID vaccine. So you have the vaccines from Pfizer and you have from Moderna, right? Now, if you look at the vaccines from Pfizer, it has very, very technical and very stringent storage requirement. For example, the vaccine from Pfizer requires storage temperature as low as minus 75 degrees. Right? Moderna is even a bit better. You could store it in the fridge, but it can only survive for just 1 month. As I speak with you, even with the normal vaccines that if you store for 2 to 8 degrees in the fridge, will run for as high as 2 years. There's still cold storage in Nigeria is still a challenge. Storing vaccine in Nigeria, and I think with the support of Gavi and the commitment from the federal government, we've really made very significant improvement. But there's still room for improvement. So cold storage is still a challenge, not only in Nigeria, but in the African region as a whole. And that's even storing at 2 to 8 degrees centigrade. But to now say that a vaccine will be stored at minus 75 degrees. So it will be I'll be pleasantly surprised if the African leadership and the system can put in infrastructure in place to actually support that. But I think the chances are very remote. So for the vaccine from Pfizer and the Moderna vaccine, my take is priorities will be first for the developed countries, first of all because of the challenge of storage and also because of need. The developing world need the vaccines more than have a greater need for the vaccines than the developing countries because of need. Now, if the vaccines, and also don't forget that once in research into a vaccine, it's humanly impossible to produce enough quantity that would take care of the whole world. It's humanly impossible. So the first vaccines have to prioritize. So where do you prioritize it? You prioritize it to countries where you have the biggest burden. And even when it comes to developing countries, I see a situation where it will be targeted at the vulnerables. So looking at the vulnerable ages, those with predisposing disease conditions, and maybe travelers, because I see countries like Australia insisting that before you come into Australia, you must take the vaccine. So those who are traveling might be prioritized. Those who have concomitant diseases that can predispose them to mortality will be prioritized. And those whose age, too, will make them vulnerable will be prioritized, even within the developing countries setting.
Yeah. Assume COVID was, maybe like Ebola, for instance. Maybe it was more fatal, and it was maybe more, maybe the mortality rates in Africa or developing countries was a lot higher than in Europe. Assuming that was the case, the reverse was the case, do you still think, because there's all these controversies about how the politics of distribution and commercialization of vaccines are dirty? I mean, it might be a myth, it might not be true, I don't know, but if it was the other way around and the developing countries had the higher burden, do you still think that the companies like Pfizer and Moderna will prioritize Africa, for instance, before giving Europe?
That's a very important one. The world is becoming a global village. And it's so difficult to now lock a disease within a region because there's increase in migration, in travel. The world has become one. And so I'm not sure it would be wise to leave a disease within a setting because it's over time that disease is going to spread around. And so that's what I see. I think, look at Ebola, there's a lot of commitment, even on the part of the Western world, to deal with the Ebola malaise, and so the world looked at that. So I think that, thank God, the world is getting closer. I'm sure if you do survey the number of flights 30 years ago and now, I'm sure it has increased in quantums. So it's difficult to actually lock your border now. So disease is very universal, it's ubiquitous, and it's also democratic in a way. So I think even if it was an African disease, the Western world will be committed towards it. Think of it. Malaria is actually a problem of Africa, basically. And there's been a lot of commitment of funding for malaria vaccines, even by Bill Gates, Bill and Melinda Gates Foundation, many other funding. I mean, look at global funds for malaria, TB, and HIV. These diseases are basically developing world diseases, but you see a lot of funding coming from the Western world. Look at Gavi, for example. The vaccines are actually given to developing countries. Who are the funders of Gavi? Bill and Melinda Gates. Some other countries in the Western world, I think Netherlands, Norway, countries who pull in funds to support diseases, to prevent diseases, protect children that are not within their own domain. Countries will develop. So it's important to actually recognize and appreciate the efforts by the developed countries in actually helping the developing countries to manage to live a better quality of life.